Hello everyone, Dr. Clark here with Babies After 35. We are going to be joined here soon by Dr. Prem Fort. He is a neonatologist at Johns Hopkins All Children's Hospital in St. Petersburg, Florida. I can't say that. So we'll wait for him to join. Can someone give me a thumbs up if you can hear me okay? Okay. Okay, there he is. Let's see. You should be joining soon.
Hello, hello.
You're festive. You're ready for today.
Hey, it's Cinco de Mayo. You know it.
That's
Having
right.
my-
I this is as close as I could get. So
That works,
but
that
thank you. I
works.
appreciate the effort.
Sure thing.
So I was just introducing you. This is Dr. Prem Fort. He's a neonatologist at Johns Hopkins All Children's Hospital in St. Petersburg, right?
That is correct.
That's near Tampa.
Yes, exactly.
It's near Tampa.
St.
Yeah.
Pete. Mhm.
It's now Tampa. Okay, we're going to jump right in. Now,
So
Dr. Fort and I, a few days ago, did a joint post together on vaccinated and unvaccinated individuals seeing newborns and infants. And I felt like I laid it out and there would be no questions. That's not true.
social
People,
media.
like, how can you still have a question? I thought I explained everything. But that's why we're here. We're going to
It's great.
start from the top and we're going to go through the recommendations. And then we're going to answer some questions. I have some questions that were already asked before that we're going to answer, and then we'll see how much time we have, and we'll go through the questions here. So, Dr. Fort, for the definitions of a newborn, means what age is the newborn? I've seen anywhere from 0 to 3 months or 0 to 2 months. Is there a right answer?
Yeah, and some places 0 to 1 month. So
Okay.
it is essentially somewhere in between that. Just like anything in research, there are different definitions. So,
Yeah.
newborns essentially you can say it's up to 3 months.
Okay. Is that generally what the AAP or American Academy of Pediatrics follows as well? Is it
I would
0 to 3 months?
I would have to, I
think
think
it is.
that's correct, but I would have to actually go,
Yeah,
I think that's
it
correct
is 3 months. Okay, and then but an infant would be 0 to 1 year, with the newborn being in that 0 to 2 to 3 month mark, right?
That is absolutely correct.
Okay. Toddler is going to be 12 months to 3 years.
That's correct. Yeah.
And then a preschooler is a 3 years to 5 years.
To 5 years. Yeah.
Okay. Now that we've laid out those definitions on what makes a newborn and an infant, that's who we're going to specifically talk about. But we will add a little bit about the 12-month or the 1 year to 2 year as well.
Yeah.
So
correct.
Who is high risk? And let's talk about as a neonatologist, pediatrician neonatologist, what makes a newborn high risk? When we talk about all the things when it comes to being around vaccinated people or unvaccinated people being around high risk individuals, there's a lot about over age 65, certain medical conditions, but there's not a whole lot about the babies. So
Right.
0 to 3 months newborn is considered a high risk person. Why is that?
Yeah, and I would actually even extend that to less than 1 year of age.
Okay, so it applies. So the same recommendations are going to apply from 1 year and under, right?
Correct. That
Okay,
is
so
correct. And you mentioned the adults too. Like the adults, obviously the older the adult, the higher the risk. So it's the same thing. The younger, in this case, in our case, the younger the baby, the higher the risk.
Okay.
And this, even that we have I have a lot of followers that are on the, preemie side of things. And so obviously the more premature you are, the higher the risk. But yes, essentially the big picture is that your immune system is still very low. As you're sort of developing into your first year, and you could even extend that into your second year, and I know we'll get into that between that gray zone of 1 to 2 years, but your immune system's still developing. You're fighting cells. So you, as you well know, but for everybody, your white blood cells, which are your fighting cells, they are made up of different types of cells. And they're all still kind of learning about, life. They've been inside, the uterus. They've gotten a lot of antibodies, or they've got some exposure from mom. But now they come out to the world, and they're getting exposed every millisecond. Yeah. And so the immune system is beginning to not only grow and develop as cells, but also get exposed to the world outside and develop that way as well. So that takes time. It is not immediate. And therefore, while that's being built, they're not going to respond as well and as strong and as robust as an older child would, or definitely an adult. So this is what puts them at high risk. They're not necessarily more contagious. They're not necessarily getting more chance of getting COVID. It's just that if they do, they can get sick very quickly. And when we talk about being sick, we talk about being hospitalized, needing a respirator, or God forbid, even increased mortality.
Okay. Okay. So simply put, any child 0 to 1 years old is considered high risk simply because of their immune system. Even if they were a term baby, have no medical conditions, and they're perfectly fine, they're still considered high risk. Now, if you add on prematurity, any medical conditions the kid might have, if there's a congenital heart defect or anything else that might add to that, that places them at further risk, right?
That is correct. That is absolutely correct. Especially in the premature world, if you're premature and you have lung disease, you have chronic lung disease, what we call bronchopulmonary dysplasia, then that definitely puts you at sort of high risk. So that category doesn't exist, but that's sort of the way I explain it. You are now not only high risk because you're a baby, because you're an infant, less than 1 year of age, but because you had lung disease, you're at much higher risk than other infants at that age. And this is where I've had a lot of questions about, preemie moms. When can we kind of outgrow that prematurity? And that's usually at age 2. So if you did have a super preemie or ELBW, extremely low birth weight infant, by about age 2, you can sort of begin to relax a little bit as far as sort of the immunity or the developing immune system is concerned.
Okay. So for the purposes of this conversation regarding visitors being vaccinated or unvaccinated, any child under age 1 is going to be in that high risk category. Now let's go to age 1 to 2. That is what Dr. Fort referred to as the gray zone. Let's talk about children age 1 to 2 that are otherwise healthy, no issues, were not born premature. Are they considered high risk?
Yeah, so this is, again, we talk about that gray zone only because this is where, and even the CDC sort of recommends allowing the parents to make that decision. Obviously, you should do the same thing for infants, but in that gray zone, it's really about the benefit of that visitation versus the risk of exposing that 1 to 2 year old to that adult. Obviously, if we're specifically talking about grandparents, they haven't seen them in a year and a half. They're getting to a point of depression, and this is going to be something that is going to be so psychologically beneficial to that interaction, and they've been really low risk. They've been, staying. So if the risk is low, and the benefits, the psychological benefits, psychosocial benefits of that are, higher, then that is up to that family to make that decision. What you want to do, though, is try and minimize that risk interaction. So this is where, if you're going to do that, it's best to do so outside. It is best to obviously still use, a mask, and wash your hands, or if you have, alcohol, make sure you clean yourself before and afterwards. If you're in close contact, you use your mask. If you're, beyond 6 feet and you're outside and this is a vaccinated home with a vaccinated adult visiting, you may, consider not using the mask for that 1 to 2 year old.
Okay. And then 2 years and up, we're not considering them high risk. Now, that would change, of course, if you have a child that's 1 to 2 or 2 and older, and they have medical complications or medical illnesses or lung disease or anything else that might make them medically more susceptible. We have to take that into consideration in the situation, right?
Absolutely, definitely. And just like you've talked about the adults, it's the same thing for children. If you have a 3-year-old who has diabetes, early onset diabetes, then that's a higher risk. If you have, a 12-year-old who has obesity and hypertension, that's still high risk. So that you do take that into account, even for children.
So if any parent has a child above age 1 and they wonder if there's anything about that child's medical circumstance that might make them high risk, ask your pediatrician, and they can give you the recommendation as to whether or not should I consider my child who is 3 that has asthma, Should I consider that child high risk?
Right.
What if they're 5 and had if there's any question, just talk to your pediatrician so y'all can make that determination together.
Love that.
Would that be good
Absolutely.
advice? Yeah.
Perfect advice. Absolutely.
Right. So now that we went over why newborn infants are considered high risk, and for this rest of this conversation, I'm going to refer to as infants, since we're considering that age group 0 to 1, regardless of health status. We're considering that group high risk. We already went over that. Now, one thing that I wanted to ask. Was something that I read that says while children generally have mild COVID symptoms, newborn and infants can be more vulnerable. So it's true that children have milder symptoms, but is that at a certain age? Do we have any data that says when a child is above 3, they tend to have milder symptoms? Is there anything like that in the pediatric world that we know?
Well, again, it goes back to that sort of less than 1-year-old.
Okay.
The way they may become symptomatic like an older child, in the sense that you may have, sort of the snotty nose, the rhinorrhea, the sneezing and the coughing, but they may progress much quicker than what you would expect a 4 or 5-year-old to progress. So you've got a 6-month-old may start like that, but very quickly develop fever, very quickly is no longer eating. A 2-3-year-old that, has decreased eating during a day, maybe not drinking as much, the body can tolerate that a little bit. You don't want to see that in a 4-month-old who needs to be feeding, consistently every, 3 to 4 hours. You want to make sure you're getting well hydrated. Dropping 8 hours and not getting any fluid, that's going to be much more critical for that 4-month-old versus that 4-year-old.
And one thing, when we did this post together, I had a lot of pediatricians make this point, which I do think is a valid point. And this is not even in a pandemic. This is just with a newborn infant in general. If you have a newborn infant, and I know for me, I had preemie twins. I didn't have hardly anybody in that house for the first, almost nearly a year, unless they absolutely had to be there for childcare reasons. And then my mom came to visit. But they were my mom was Tdap vaccinated and flu and everything else that she could get in order to come. But they said if you put them at increased risk of exposure and those newborns develop a fever or that infant develops a fever, the potential for needing a really thorough workup, meaning some invasive testing, is higher. Why is that?
Yeah, exactly. And this goes back to sort of you have the Red Book, the American Academy of Pediatric Recommendations. If you have a baby that's less than 30 days old and has a fever, unfortunately, it may be the first sign of something very serious, like meningitis, like an actual infection that, with the tissues or fluid around the brain, which would have a, severe detrimental effect if not treated. And so, unfortunately, as opposed to a 12-year-old kid who can come into the emergency room and say, I have a headache and I've been having, sore throat and I hurt here, here, and here. Obviously, a 2-3-week-old cannot do that. And this is where, unfortunately, we have to investigate all tissues to make sure we're not missing something. It's just not good enough to treat maybe for a week of antibiotics and say, well, we'll probably hopefully killed it, because these bugs sometimes actually need up to 3 weeks of treatment if it's surrounding the fluid around the brain. And so if untreated or treated partially, this could be extremely detrimental to that child down the road. So we have to investigate with blood cultures, meaning you obtain blood and you run a culture to see if there's actual bacteria there. We have to obtain different type of, blood tests to see if there's any parameters for infection. And then the hardest thing, obviously, for parents is that we have to get a lumbar puncture. And that's where we, go in with a small needle in the back to get some fluid from that liquid, as I mentioned, that bathes the brain. And then we can be more reassured. And the great majority of these are going to come back normal. You actually should be happy they come back normal, but you just don't want to miss that one, because it can be really, really bad for the brain.
Yeah. So that's another reason why you need to be vaccinated or not. And we'll go into this in more detail, pandemic or not. Children under 1, and especially those first few months of life, you have to be very particular about who you bring around, because if they end up getting a fever, they might have to be subjected to something like this. And it's not fun as a parent to have to go through that with your child. So those are even more reasons to be especially selective about who is coming around. Like I said, COVID vaccine or not, pandemic or not, this is just a general recommendation. Okay. So let's go to we'll go over again, what's the definition of a fully vaccinated individual. A fully vaccinated individual means 2 weeks after their second dose in a 2-dose series, and that's with Pfizer and Moderna, or 2 weeks after the single dose, which is Johnson & Johnson. If you don't meet these criteria, you're not fully vaccinated, and you need to keep doing whatever precautions were taken pre-vaccination until you're 2 weeks past that last dose of whatever vaccine you're getting. So that's what makes it a vaccinated individual. So now let's go into the CDC guidelines for visiting people, vaccinated people visiting newborns and infants. Now, what Dr. Fort and I did, we went through what the CDC says, and based on what we talked about at the top of this discussion, with newborns and infants being considered high risk, 1 to 2 is a gray area, greater than 2 is not considered high risk. We're using these CDC guidelines for vaccinated people visiting if there is a high-risk individual in the home, which would be the newborn and infant, right?
That's correct.
Okay.
That's correct.
So if you have a newborn or infant, let's say a child under 1 year old, and even if you're vaccinated, meaning parents in the home are vaccinated, this still applies to visiting individuals, right? So let's talk about visiting individuals who are vaccinated. What are the general guidelines? For someone outside of the home who is vaccinated, fully vaccinated, coming in to visit a child in a home that's under age 1.
Right. And again, it's so important to, obviously we use grandparents as a great example because obviously they're the ones I know that there's been a lot of, there's been some stuff published about the psychological part of how it's affecting, the grandparents not being able to see their grandkids. So I use that as an example, but obviously we still, because they are still at high risk, we can't just go in unmasked. So the recommendations right now are for those adults to be able to now go indoors, vaccinated adults are able to now go indoors and spend time with a vaccinated family. But if you have a baby that's less than 1 year of age, you do have to wear a mask. We obviously want to be able to protect that baby because even though you are vaccinated, there's still that 5% chance, of passing that you are actually carrying the infection and passing that to the baby. Yeah. And again, as opposed to the older kids, if they were to get a little bit sick, they'll get a little bit sick. But there's a much higher risk of that baby getting very sick from it. So masking, if you're going to be holding the baby for sure, you want to make sure you have that mask on. You want to make sure you have you're washing your hands before and after you touch that baby as well.
Okay. And what about, so wearing a mask while holding the baby, washing the hands?
Yes.
But there's also said that you might need to physically distance. If we're indoors, should we physically distance?
Absolutely.
Even if we're vaccinated? Yeah. So that was one of the questions. I have a vaccinated grandparent who wants to come in and see my newborn. Yes, they'll wear a mask, but they're not allowed to hold the baby.
Yeah, no. So again, if you are going to do that, and again, this is where it goes back to that, parent making that decision of benefit, versus the risk. But if you are going to have that vaccinated family member or adult come into the house, you will want to make sure you keep that, distance. But if you are going to hold the baby, making sure that you wash your hands appropriately. And when you are holding the baby, that you have a mask in place. And then afterwards, again, you can go ahead and, have your 6 feet or greater and wash your hands after you touch the baby. And I will add, this is, by the way, the same for children. And I know we're going to get to unvaccinated adults, but this will be the same for other children who are in the presence. Obviously, right now, we don't have vaccinated children, at least not less than 16 years of age. So you do still have, if you have an 8-year-old that's coming into the home that is unvaccinated, you are going to want them to put a mask on, and the same procedure, put a mask on, wash hands, hold baby for the length of time, and then wash hands after that.
Okay, so let's just break it down. If you are, again, this is irrespective of the vaccination status of parents. If you have a child under 1, considered high risk, and a vaccinated, we'll use the grandparent as an example, comes into the home. It's, one family visiting another family. Yeah. The preference is wear a mask, wash your hands, physically distance in a well-ventilated space, indoors, if you're going to be indoors. However, the parents can make a decision as to whether or not they want to allow the grandparent to hold the child. But you still have to understand there's still a risk there. Now, if you really want them to be safe, the best place, even with the vaccinated individual, is outdoors.
Yeah,
Okay.
correct.
But we understand, this has been going on a long time, and people want to commune and be in their homes with their vaccinated grandparents or loved
Yeah.
ones who want to see the newborn, and we get that. You just have to make the best decision. Outdoors is best, even if it's a vaccinated visitor with a newborn or infant under 1. But if they're going to be indoors, definitely wear a mask, definitely wash those hands, preferentially physically distance. But y'all have to make that decision together. The guidelines are to physically distance for a high-risk individual, but I understand if people want to fudge that a little bit, but you have to understand there's still going to be a risk if that child is held, even with a vaccinated individual, right?
Absolutely. And basically the main difference between, being indoors, everything we talked about, that vaccinated adult, that newborn, being indoors and outdoors, is that outdoors, when you're not in close contact with the baby, you can have your mask off if you're in that sort of environment with other vaccinated adults. You can go ahead and have the to hold that baby. You do want to make sure that you have your mask on, and we talked about washing hands before and after.
Right. So let's take that same scenario. If the vaccinated grandparent is coming into the home as a visitor, obviously outdoors is different, but indoors, vaccinated grandparent coming in, you have that child that's 1 to 2, that's a gray area. That's going to have to be determined by the parent, maybe with consultation by the pediatrician if it's needed. But like Dr. Fort said at the beginning, the risks of exposure versus the risk of, the consequences of not having seen that grandparent, you guys have to make that determination together. If the child's over 2, then there shouldn't be an issue with being indoors. The grandparent does not need a mask because that is not considered a high-risk individual, right?
Absolutely. That's correct. And I think one of the hardest things of that decision, it's not so much the holding the baby. I've had a lot of, on my account, I've had a lot of people ask, can I kiss my baby? Can I kiss my grandson? And of course, that's the hardest thing, because it's not just the holding, but that physical contact. It's extremely hard. But again, just like you said, you've got to make sure you sort of balance that risk. Hopefully soon, and I know we've been saying that for a while now, but hopefully soon we're going to start bringing the vaccination down to children, younger children, and even down to 6 months.
Right. So that answers the question about vaccinated individuals coming into the home with a child under 1 and under, 1 to 2, and 2 and above. Now, this is still considering that you're doing single households coming together. That's not multiple households coming together. We're not even going to go there. If you have a child in the house under 1, that should not be happening. Okay, that's too high risk. Okay.
Correct.
Now, if you have an unvaccinated visitor who is coming or wants to come to see the child that's under age 1, what say you?
Yeah, so
unvaccinated grandparent, aunt, whatever, they want to see the child that's under age 1.
Yeah, this is where, again, I know we've talked about leaving it to the families. This is, again, where there is very little, in this case, the risks of having an unvaccinated adult come in who may be asymptomatic, not having any symptoms of COVID, come in and give that to the baby, they're too high.
Yeah.
And there's really there's very little benefit you can say that would trump any of that high risk. So you've got an adult who's higher risk, giving it to a baby, could be giving it to a baby who is high risk. So that's high on high. So this is a situation where I would see no benefit that would trump that situation. And so the recommendation would be not to have that exposure.
That exposure indoors. Now, you can be outdoors under age 1 with an unvaccinated individual as long as they are still wearing a mask and socially distancing outdoors.
That is correct. So that's the difference. There you go. That's the difference between what we talked about with vaccinated adults. Outside, if all groups, if all adults are vaccinated, they can be without the mask until they approach the baby. In this case, for unvaccinated adults outside, they still have to wear the mask, even outdoors. And then definitely physically distance. And again, I would have that family prefer not have that family member, or sorry, that adult, even unvaccinated, even with a mask, then approach the baby outdoors as well. These are recommendations, but obviously. The recommendations are there, and that's why we're having this conversation, because people are asking, and if they're going to follow, this is the best
guidelines to follow. Now, let's do the 1 to 2. Gray zone,
Yep.
unvaccinated individual, child is age 1 to 2, wants to visit. What do we tell them?
Yeah, indoors. Yeah, so indoors
So some are
again.
indoors. Mm-hmm.
Yeah, so
Yeah.
this is again, I would not be
Mm-hmm.
comfortable, and again, this is not just me saying, but following the guidelines,
Mm-hmm.
you would have to really have a really huge benefit,
Mm-hmm.
overseeing that. If you
Yeah.
have an, adult that for whatever reason just needs to that bonding just absolutely needs to happen, then you
Yeah.
sort of, weigh that. But the reality of that recommendation is that indoors, you would probably not want to have that contact.
Yeah. And in outdoors, obviously, if they're distancing and wearing a mask, that could occur.
Yeah,
I think really any person, and kids are persons that are not
yeah,
able to be vaccinated, and they can't right now.
yeah.
Kids under 12 for sure. Next week, I think, is when kids under
That's
12
what they're
can
looking
get
at
to
it.
be,
Yeah.
right?
12 to
They're
15.
not
Yeah.
able to be vaccinated. The
Yeah.
younger they are, the more less mature the immune systems are. I personally, as a physician, I'm sure you would agree, I would not have unvaccinated individuals in my home with my children. Okay, unless that
100%.
absolutely has to occur.
Yeah.
But
Yeah.
you have to make that decision, and you have to understand the risk and be willing to accept that risk. Okay.
Correct.
Um,
Correct.
the other thing is, even outdoors. So,
Yeah.
I get it. It's
Yeah.
hard, but we have children, especially those young ones under age, 4 and 5 or so, and we still have to keep them in mind because we don't want them to get sick, and we don't want that exposure. So it's much easier if they're unvaccinated. I think the general rule of thumb is no, unless you're wearing a mask and socially distancing
Yeah.
inside the house or even outside, as far as visitors with
Yeah.
kids, right?
Yeah. Absolutely. Yeah. And one of the things that I hear a lot is, but I've seen the news, and I've seen, the posts that, babies don't really seem to be getting COVID. So why should I be too concerned? And again, it
Yeah.
goes to the fact that they are not more at risk for getting COVID. They're
Yeah.
more at risk for getting sick from
Sick.
COVID. So,
Yeah.
so the probability may be the same as a 12-year-old, but if they get it, they can get much, much sicker. And so that's what we're talking about here. And that's why we want to protect those less than 1-year-olds for sure.
And then lastly, the general rule of thumb, if you have kids at home under 1, I would say 2 and under really, and you have multiple households coming together,
Yeah.
even if they're vaccinated, the best place to be is outdoors.
Yes,
Okay. And if they're
absolutely.
coming around a high risk kid, which would be 1 and under, mask, socially distance, or not even be around it.
That's correct.
Best place to be outdoors if you're starting to mix households, even of vaccinated individuals. But if you're going to be indoors with multiple households, any high risk kid, 1 and under
Yeah.
for sure, possibly 1 to 2, mask
Yeah.
and physically distance.
Absolutely.
But if we're going to ask me, I would say avoid multiple households. That's the
Yeah,
easiest thing
that's
to do for now. Yeah.
indoors for sure. Indoors for
Yeah.
sure. If you really want to have a couple of neighbors, and again, we're talking about small groups, and that's
Yes.
still the CDC recommendation.
Yeah.
Even vaccinated adults, they're not talking
Yes.
about big groups. They don't specifically mention group. But if you have a couple of neighbors that you're just really friendly with, and you've got some kids, and you've got all vaccinated adults. Again, if you have that 2-year-old or above, that's great. Be unmasked, have a wonderful time.
Yeah.
But if you have a less than 1-year-old, you'd still want them to,
Yes.
if they're not in proximity, they can be unmasked. If they're going to
Yes.
approach that child, you ask them, please, wear a mask,
Yes.
and wash your hands before and after. We just don't want to risk that exposure.
Yes. Yeah. Yeah. Or like what I did with a couple of my husband and I are friends.
Yeah.
They have two children. One's 3, one is almost 2. We just went outdoors. All 4 adults were vaccinated. It's just safer. Just be outdoors.
Absolutely. I mean,
everything. Yeah.
We've reached the point, I mean, and everybody has, right now, COVID burnout. I was just talking to somebody the other day, and we said, well, it looks like things may be opening up in a couple of months, and we were really excited. We said, yeah, I can't believe it's finally, it's coming so soon. And then we realized we've been at this for a year and a half.
Yeah.
I mean, we're all burned out, but we're so close, and this is where we urge you, please, follow these recommendations, because we're so close. We want to make sure everybody's safe soon enough. Everybody, will have, even down to the children, will be able to have the vaccine, and then we can open up the world safely for everybody.
Yeah. Okay, so I'm just going to go through some other general considerations or points or questions that I was asked. One point was, although these are recommendations, and again, someone just popped up on the question, where do we get these recommendations? These recommendations are from the CDC for vaccinated versus unvaccinated people and visiting different households, but we're using what's considered a high-risk person because we know that children definitely 1 year old and under are considered high risk. 1 to 2 is a gray area. 2 and above is not considered high risk. Now that's going to change if any child has any kind of medical condition that would place them at increased risk for infection. These are otherwise healthy children. So if there's any question about whether or not your child is at high risk for COVID infection, if exposed, you need to have that discussion with your pediatrician so you know where your child stands, no matter what their age is, actually, but especially if they're age 2 and under, okay? So that's where these guidelines are coming from. It's just common sense. CDC put out the guidelines. We know that children under a certain age, which is 1, are definitely considered high risk. And these are exactly what I'm doing off of the website. We're just putting, instead of a high risk being age 65 and older, it's a child under age 1. That's all that this is. Okay.
The other extreme. Yep.
Yeah. Because people are giving me crap. Where are you getting these guidelines? It's common sense. It's common sense. We're not making this up. This is not Dr. Fort and I deciding, oh, we're just going to, say these are guidelines. It's what CDC has put out and what we know as a high risk individual as far as a child goes. Okay.
Correct.
Next, and this is another good point. Limiting the number of visitors reduces the risk of exposing your newborn infant to COVID-19 or other serious infections in the first few months. Now, there are other things we have to worry about besides COVID. Regardless, yes, we're in a pandemic and everybody's got COVID on the brain, but what are the other things in newborns that we have to worry about?
Yeah, this has been really, I mean, it's apropos. We were just actually talking about this yesterday. We were kind of running through the year of the NICU and all these infections. One of the things that we would see in the PICU and NICU was something called RSV, or respiratory syncytial virus. And this is actually fairly common, not fairly common, but this can actually cause a lot of illness in premature babies, but even full-term babies, even to a point where if they're less than 4 months, with your twins, you probably, know a little bit about this.
Yeah. They just missed the criteria for vaccination.
For the vaccine. Okay. And even with the vaccine, obviously it doesn't fully protect you. So you still have to be very careful, but this virus actually can be very, and has been sort of our scariest virus. Well, we have no numbers there has been no admission, no RSV in our NICU for a whole year. Yeah. So it's been, it really goes to show the hand washing and the distancing and the masking it works. Absolutely works. We were all just, dumbfounded by by those results. Yeah. So yes, there are other viruses, doing this not only as we talk about COVID, but definitely protects you against other viruses. And hopefully as, the world opens up and, COVID begins to calm down now and we get vaccinated and so on and so forth, we'll remember these things so that we can try and keep these numbers down. RSV is going to slowly increase. There are other colds and viruses that will slowly increase. But if we can keep them lower than we have in the last decade or two, it's going to protect babies. And, even from just being in the hospital, no parent ever wants to be in the hospital, even for a night or two. So if you can just continue these hand washing practices before and after and so on and so forth, you'll be able to protect your child from even just going into the hospital.
Yes, good point. Now we're going to talk about this, masking, face shield. What are the guidelines for kids?
Yeah, this is extremely important. So absolutely. So in the United States, it is not recommended to use any mask or shield at less than 2 years of age. 2 years or above, you go ahead and use your mask. And this is extremely important because there's been already studies showing that this increases, if you are less than 2 years of age, it increases the risk of suffocation. What does that mean? There's not enough oxygen coming in. The CO2, which is one of the gases that we expel when we breathe out, it stays in there. And it can actually cause babies' oxygen to drop and get very, very sick. And so this is an absolute no-no for less than 2 years of age in the United States, where I'm actually part of a group internationally. And, Europe has something different. Australia has something different. So we're actually putting out a guideline for the world. And I'll post that, whenever that comes out.
Yeah. And while we're on the topic, there was some stuff on social media. There's been a lot of stuff. Dr. Fort and I share information.
Yep.
That people were saying children wearing masks is child abuse. Now listen, we just told you why it's not recommended for age 2 and under. Now my kids, they wear a mask. They can rip and run and do fine. It is not child abuse to make your child wear a mask to go anywhere. I don't even have to ask them anymore. And my kids have been doing it since they were, I'm trying to think how long ago. So they're 4.5 since they were 3. Yeah. Okay, so it is the right thing to do. In other countries, they've done it a lot longer than this country has done. for other reasons.
Yeah.
It's just 2 and under. It's not recommended. Now, is there anything about any kind of medical condition that would make maybe an older child not be a candidate for wearing a mask or a face shield or anything?
I'm so glad you mentioned that because we
Yeah.
forget about that sometimes. We
Yes.
just talk about ages, but absolutely. Do you have certain conditions in, children that are older than 2 years of age where you would not want to mask them? And a lot of that tends to be if they have some mental deficiency,
Yes.
if they're incapacitated in
Yeah.
a certain way, if you have a 2.5-year-old that just is constantly playing with that mask. Then at that point, or they're taking it off consistently, at that point, you're not seeing much benefit, from that. And the touching is actually causing more of a risk for getting, the virus into your nasal passage, which is how it gets into the body. So, there are definitely those certain situations,
Yes.
any situation. And for those that are concerned about masking a child or putting a mask on a child because they've maybe read that the CO2 or the gas absolutely not true. What has been studied are minimal amounts of CO2 increasing by maybe 2 or 3 points, which does absolutely nothing bad to your brain at all. But mask protects you from COVID, which protects you from getting really sick. So there is no reason not to, unless again you have a child who has some problems, who would be putting a mask on would not be good for them.
Yeah, so if your child is over 2 and you're concerned because they do have something with their medical condition, then just talk to your pediatrician and get their recommendation if they think it's best or not, if there's an alternative or anything else that might be more beneficial for that child. What was the next thing? Now, this is also another good point that one of our pediatricians here on social media brought up. There are more and more cases of postpartum depression and anxiety due to a lack of support postpartum with new baby. Family and friends should strongly consider getting vaccinated so they can help new parents and baby. And that is such a great point.
Yes.
I had twins, newborn preemies, and it was tough. And I wasn't in a pandemic. I could not imagine going through that and being in a pandemic where I couldn't have people helping me because it was tough. And so I understand. And so if you are a friend or if you are a friend or a family member and you have a new parent or a daughter with a child on the way, it is better, we don't just do the vaccination for ourselves. We do it for the benefit of society. We do it for the benefits of our families. I mean, there's multiple reasons to consider the vaccine. So it's not just, one reason. It's about everybody that we love. Really, it is. So consider that because they do need our help. So if you are a vaccinated individual, and they have a newborn at home and you're vaccinated, you can go help them. And which can help with the postpartum depression and anxiety rates, which have increased in the pandemic, for sure. Yes. What would you say about that?
Yeah, 100%. I love that comment from that pediatrician. I think it's so important because you're absolutely right. Vaccination is not just about us. Of course, we protect ourselves, but it's also about protecting our own kids and then helping those in need. And this goes back to what you just said. If you know that there's going to be a new mother, if you know that there's a young mother who may have 4 or 5 kids, that's still having to go to work for whatever reason, then you are able to support if you're vaccinated. Yeah. If you're unvaccinated, that exposure is too risky. Yes. And so you may want to help, but in that case, it would not be recommended. So vaccination, very important.
Yeah. And for those parents and those with babies on the way whose family members are refusing or giving you crap because you're wanting them to get vaccinated in order to see that child, you have every right to protect your child and make those recommendations. I don't care who the family member is. I don't care if it's your mom or your dad or anybody. You have to put your child's safety first and foremost. And if anybody coming to the household is vaccinated and that's important to you, then that's what should be expected. And you don't have to explain why. You're the parent, you're the gatekeeper, and I hear it all the time. They're getting so much crap, Dr. Fort, for asking that of their family members, or they're being told negative things, and I just can't imagine having to hear that from a family member. So first of all, I apologize. I think that's awful that anyone would have to hear that, and I want to support you. And I'm sure Dr. Fort supports you too. You're making the right best decision for your family. Okay, if you're not hearing it from your family members, you're hearing it from us. Okay.
Absolutely.
Yeah. we got some questions about testing newborns for antibodies. Here's the deal.
Yeah.
We know that vaccination and pregnancy, we find COVID-specific antibodies, IgG, in the cord blood, which indicates that it's getting to baby. So we know babies are going to get protective COVID antibodies from the COVID vaccine in pregnancy, but we don't know how long they're protective for or how protective they are. We don't have that data yet. Hopefully we will get that data.
Yeah.
COVID vaccination and breastfeeding. We know that there are COVID-specific antibodies in breast milk. We know that a breastfeeding child is likely to get those antibodies, specifically the IgA ones. And we do have some studies that show that those secretory IgA COVID-specific antibodies do go up, which is great for breastfeeding. Again, we don't know how protective they are or for how long. So I get the question a lot, should I be testing my baby for antibodies? I wouldn't do it. I wouldn't stick a baby just to know whether or not there's antibodies. What would you say?
Yeah, I would support that as well. Because of what you just talked about, there was actually one study that it showed that, and this is only a case report, only one child, one newborn, and it showed that actually the antibody only lasted in this one child for 3 weeks. So testing at that point, it only makes us feel better as adults. Oh yeah, I have the antibodies.
For that moment in time.
Exactly. So you're protected for a couple of weeks in this one case. Again, we don't know that for sure, and there's just still not enough data to be able to, know for sure. Most antibodies, when you're giving vaccinations, aside from the COVID-19, most antibodies, as you well know, or if you have a disease, will last for your 6 to 9 months, and that's typically how you get protected. And that's why a lot of our vaccinations are done at 2, 4, and 6 months to sort of get you ready for when you lose mom's antibodies. But in this case, we just don't know with COVID. And like you said, not only that, but even if you have a really high level, you are going to feel good as a mom. Well, that's amazing. We won't be able to tell you what that actually means. Does a high level protect you more than a low level? Or is that low level going to be higher the next day that you got the lab? So because of all these unknowns, and because sticking a baby is just no fun. I mean, we do it all the time in the intensive care unit, but it's not something that we'd like to do. So just doing it for the antibodies, there's really very little benefit from it at this point. Again, that recommendation may change, depending on what happens with the data that we gather.
Yeah. So in other words, we know the kid's getting antibodies through being through the pregnancy or with breast milk, but we don't know what that means, and it's not going to change anything. It's not going to change what the recommendations are for what you're able to do with that child that's under age 1. So it's not really worth it. Again, it's just that moment in time that's telling you the baby might be antibody positive, but again, 3 weeks from then it may be different. And and also, while we're on the topic, I just want to say
huge props, though. I will say huge props to those moms who are getting the vaccines thinking about their baby. So I love that.
I know, and that's where I was going with this. So people ask me all the time, should I wait to get the vaccine until I'm in the 3rd trimester, 2nd trimester? This is what we know, and this is what from reading, and this is what anybody would tell you. The vaccine is to protect you, first and foremost. If you're healthy and COVID-free, your baby's going to be healthy and COVID-free, hopefully, as long as it's not exposed to anything. But that you get the vaccine to protect you. It just happens to be a bonus if the kid gets antibodies. So I would not wait to get the vaccine for the sole purpose of potentially passing antibodies to your child. You get it as soon as it's available and you're ready to get it, okay? But don't make that decision based on what you think is going to happen with the baby while you're pregnant or in breastfeeding. You get it to protect you. There's no recommendation. Go ahead.
No, sorry, go ahead.
I was just going to say there's no recommendation as far as which trimester is best. Again, the recommendation is get it when you can, when it's available, and when you're ready to get it. But again, any trimester is the same. Not one vaccine is better than the other for pregnancy or breastfeeding. I've also heard I'm going to be getting my first dose. It's available right now. I'm 35 weeks, but my second dose is going to be after I deliver. That's fine too. Okay. I've had a lot of people say, I got vaccinated, I just found out I'm pregnant. Should I wait? No, you get the vaccine as scheduled. That's the recommendation. Those are kind of just real quick rapid fire answers regarding the vaccination and pregnancy and breastfeeding. Remember, it's to protect you. I understand our wanting to protect our babies, but we should be protecting ourselves first and foremost, right?
Yeah. And I was going to just add, sorry to interrupt you there, but I was just going to add, as you know, moms are so amazing that they don't really care about themselves. I mean, if there's one thing I've learned, I've seen moms who've delivered by C-section and 2 hours later, they may be crawling, but they're going to see They're going to see their baby. I mean,
Yeah,
it doesn't
yeah,
matter if they're in
yeah,
pain. Their uterus could
yeah,
be hanging out. They're
yeah,
there.
yeah.
So, moms will. So you are actually, if you think about it, even though you are doing it for yourself,
Mhm.
yes, you will
Yeah,
know.
yeah.
Pregnant moms are more at risk for getting
Hmm.
sicker with
Hmm.
COVID-19 and even dying. And
Yeah,
not
yeah.
only that, but actually causing premature, delivery, premature babies, or babies
Yes.
could be born sicker
Yeah.
if
Or
mom gets sick.
yeah.
So in a way, you are doing it for yourself, but by doing that, you're protecting yourself
Yes.
and your unborn
Yes.
child
Hmm.
so that the child doesn't, is not born premature, and it's also not born without any actual problems because you're safe as well.
Yeah, one of the biggest consequences right now for babies are being what we call iatrogenically delivered preterm in order to
Yeah,
treat mom. Okay. And they're having the consequences of that. What iatrogenic means the baby's fine. We just had to deliver a
yeah,
baby because mom's sick. So that's,
yeah,
and then what we're seeing in Canada right now, which is, it was so heartbreaking as far as how many pregnant moms are, parents are in the ICU right now sick. And we don't really have an explanation
yeah,
for that, but it's happening. So we know that it can happen. I just posted yesterday about some of the consequences of COVID in
yeah,
pregnancy. The reason why I did that is because we've been talking so much about the vaccine, and I get it. We can't forget about the consequences of COVID infection in pregnancy.
yeah.
There are consequences, and
It's
there's
real.
consequences if you get the COVID infection in the first trimester or second trimester. There could still be consequences later on, so we have to consider that.
Yeah,
So just don't forget and use that when making your decision on whether or not to get vaccinated. But ultimately, it is your decision.
yeah.
One thing, that we're going to have to tackle this, and I hope you have some kind of brilliant answer because I don't. We talked about everything you can and can't do for vaccinated people coming in to visit. Now everybody's asking me, well, I'm vaccinated, my husband's vaccinated, my partner's vaccinated, but I have a 2-year-old or a 3-year-old or a 4-year-old in daycare, and I have a newborn. What am I supposed to do? What do they
Yeah.
do? I mean, what do they do?
Yeah, no, that's always a tough one. And
Yeah,
again, I
yeah.
think I think this is just like anything. This is where you have to kind of look at your home situation. If having your, 4, 6, and 7 year old at home, and it's just, you're trying to, deal with your newborn, dad's having to go to work, and it's just causing so much stress and chaos. Then at that point, you may again, it goes back to that benefit, risk. So you may say, you know what? If I can find that, and I would definitely ask or even go out and check the daycare. If I can make sure that they're practicing, safe practices and they're at low risk and my community is low risk, where I feel
Yeah.
safe to be able to send my 4-year-old to that or 3-year-old to
Mhm.
that daycare, then, that might actually, be a good thing and that might be okay. And because that 3-year-old is able to come back, and we've talked about, even the 3-year-old would have to mask if holding the baby. You
Yes.
know that there's still some protection
Yeah.
happening there. The tricky part is again that 1-year-old. So you've got a 1.5-year-old and you've got a newborn.
Mm-hmm.
Those are extremely difficult situations. And you're right. I don't think we have a perfect answer for that. Do you send that 1.5-year-old who's still considered sort of, high risk-ish, to the daycare?
So
That's a
I
tough one.
I thought about this and I put my mom's hat on.
Yeah.
And this is what I was thinking. If you are pregnant, and this is me, only me, and Dr. Fort can agree or disagree or add to. If I was a pregnant mom and I had uh, uh, a child in daycare, and I would feel more comfortable over age 2 um, if I knew what the policies of the daycare were or preschool, and I'm in a community where the infection rate is low. That's
Yeah.
key because
Exactly.
that child's going to a daycare and getting exposed to vaccinated and non-vaccinated individuals and other children. So you need to know what the infection rate is in that
Yeah.
community. You need to know the policies that are in place by that daycare, preschool, whatever. I was actually involved in helping make the policies for my kid's preschool. So
That's
I
great.
know and I was comfortable with that. Okay. Knowing that and asking those questions is perfectly fine. I would feel that over age 2, as long as the infection rate's low in the community,
Yeah.
the daycare preschools has great practices, I would be okay. But if they were still coming back into the house with my newborn, especially newborn, I would probably, if they're over 2, make them wear a mask, wash
Yeah.
their hands, and
Yeah.
no face-to-face stuff. It's just too risky. Now with
Yeah.
that gray area, if I was pregnant and getting ready to deliver and a child's under 2, I would personally probably pull them out of daycare because
Yeah.
it is a gray area. And I know that's hard. again, it's your family. It's just because of it's a gray area. Does that make sense?
No, and yeah.
I know. And again, this is just me trying to give what I've thought about and what I would do. But again, it's up to you. Just have to make the decision based on what's best for you and the family, and all that also being considered. The other thing to have to consider is if you're having a newborn and you have toddlers, preschoolers at home, those are still unvaccinated individuals that not only are unvaccinated, they can't get vaccinated right now. You're going to have to really think very hard before you start bringing other people into the home that are and adding more risk, right?
Yeah, absolutely. So, I mean, I completely, I agree with what you're saying. And again, I would, also add to that's sort of the family dynamics. Because again, if you've got, 7 kids at home and, you're able to have a teenager be able to take care of that, 15-month-old, then that's a much easier situation to be at. Than if you've got, 3 kids and, just happen to have 2 toddlers. And now you're having a newborn or you're about to have a newborn, and you know how much, especially the first 3 months after having a baby, they're very difficult. So if that's going to add such a level of stress to the family dynamics, then you may have to balance that out to the risk. But like you said, you definitely want to make sure that you look at the daycare, the policies, actually go make sure you can see what they're doing to make sure that they're safe. But also, as you mentioned, again, the community, as I mentioned as well, making sure that, what's your community. So it is those gray areas. You have to see your situation. It's hard to, go individually and, put out a big statement for those type of situations. And that's why nobody has. That's why the CDC doesn't have it. The AP doesn't have it because you can't.
I mean, I think as a multi-child household that are going to school, that are going to preschool for whatever reason, knowing how the school's handling it, especially for those little ones, knowing what the disease rate is in your community, doing what you can. I think especially those first 3 months and under, you've got to be really, really careful with the other kids in the home as far as exposure. Getting some guidance from your pediatrician is always, it's not going to hurt. Now, they may not have any other better advice than we do, but it's definitely not going to hurt. But if you have other unvaccinated individuals in your home for whatever reason, that is going to dictate who else you're going to allow, because then you're starting to mix and match too many unvaccinated and vaccinated people into the home. So it also depends on who's actually living under that roof, who's vaccinated and not, and as to what you're going to be able, what you should consider when bringing other people from the outside in. Yeah,
and I'll add to that. Actually, you talked about sort of having multiple kids in a home. So if you have sort of teenagers or sort of older children that have gone to school, well, some of them are having to come back quarantine, and so you want to make sure if you have a less than a 1-year-old, we talked about that sort of high risk category, that individual is actually quarantined in the room and will actually have to wear a mask within the house. Obviously, if they do have COVID, and you can see the CDC guidelines for this, if they do have COVID, they have to stay within the room, again, because you have a high-risk person in the house. So this would be different if you have somebody, that if everybody else is vaccinated and this person were to get it. You want to make sure that for these scenarios that person is really, quarantined because you have a high-risk child. Again, we're talking about that less than 1-year-old.
Yes, and I've had plenty of people who have messaged me. They were in those various situations, and they did quarantine with the newborn, the parent mom with the newborn, the other parent with the other child.
Correct.
And they did not get it. It is possible, guys. It is possible if you do it the right way. It's possible. It sucks, and it would suck, but it can be done. And I've seen that happen. I've had multiple people message me about that. Now, we need to answer questions, but one other point that
there's a lot of good questions there. Yeah.
So real quick. So one option to unvaccinated individuals that was proposed was that they quarantine for 2 weeks or they get tested. So I don't know how much I would trust that with my infant and newborn. I personally don't know that I would, unless I knew explicitly where they were quarantined for 2 weeks, or how whatever testing they did, how long it's good for, and all that, and where they got exposed between here and there. I mean, to me, that's a little too risky for me. Yeah. But I understand that some people are asking about that. Do you have any recommendation on that?
Yeah, no, I think what you just said is correct. I mean, honestly, I think it's great that they're looking at some type of a situation that could minimize the risk. Again, anything we do in medicine is about minimizing risk. So they're looking at a situation where that unvaccinated, grandparent or adult really wants to come in. They're doing the best that they can. But just think about that, that person getting tested the day before they travel or 2 days before they travel to come see you. They go put gas. As they're putting gas, they've actually picked up now COVID from an unvaccinated person
It's too
or
hard.
somebody who got it.
It's too
Too
hard
many
to
variables.
control. Yeah, it's too many
Too many
variables.
variables. And then again, when you're dealing with a high risk child, or again, we talked about those infants, you just don't want to get to that exposure. And unfortunately, the world out there doesn't see the sick babies. I'm telling you, as a neonatologist, and we've seen,
or
the sick moms, correct. I mean, we've seen those that get really sick, and even die, and it is the toughest thing to see. So this needs to be taken seriously, at least until we can get this under control.
Yeah. Okay, here's a question. If both parents work, are in contact with others, how can we protect our babies when we go home? So, if you're first, I would say get vaccinated. But even if you're vaccinated, if you are vaccinated or can get vaccinated, I would still wear a mask at work. Wash your hands. Stay away, especially if you had that newborn infant at home. Doing everything you can to minimize your exposure. Vaccinated, especially if you're not vaccinated. I understand parents have to work. They do. They have to provide for their families.
Absolutely.
It's all about minimizing your risk of exposure to someone who might have it or is unvaccinated. But if you had the opportunity to get the vaccine, I would get the vaccine. That's a huge, a huge weapon against COVID is to get the vaccine. And if you have that ability to get it, I would get it. But if you choose to not to for whatever reason, you just have to, do all those protective measures, right?
And absolutely. And I'll add, there's some jobs where you may be out there and you may be out in the field, or you may be out in some construction site or something like that. Nobody's wearing it. You wear that mask. And if anybody tries to say, well, wow, why are you so special? I have a newborn. That should be your quick answer. I have a baby, so I have to protect my baby. If anybody ever questions you for that, then I wouldn't get too close to that person. If you have, absolutely, 100% masking.
Yeah. Now here's a question: do you suggest weaning a 12-month-old during this time mom is vaccinated? I don't know what that question is asking. If you're breastfeeding and you want to continue breastfeeding, I don't know why you would wean. There's really no reason to, right?
Yeah, no, absolutely. I don't think it needs to. You just go at least 6 months. Obviously, it's recommended 6 to 9 months, or as close to a year as possible. And you can stop cold turkey. But as you introduce your foods, and this is something that you will do very close with your pediatrician, and start introducing foods and start kind of coming off. But there's no reason for COVID that you have to wean.
Yeah, this is a great point. Comment regarding something we talked about earlier. I have a 27-weeker. Preemie baby who just turned 2 a few weeks ago. He has bronchopulmonary dysplasia, which is a lung disease, chronic lung disease, and so many people do not agree with how strict we are right now. You are absolutely 100% right that even though your child's 2, he's still at high risk based on his pre-existing medical conditions, and you have every right to be strict, right?
Absolutely. I literally had I had someone DM me right before we got on about that same situation. It might be even the same person, and this is absolutely true. Even if your child is 4, 5, 6, if you've had a history of chronic lung disease, that puts you into higher risk, even if you're older than 2 years of age. And it is all about protecting your child. I mean, this is one of those situations, a pandemic, where, you really have to, as moms and dads, sometimes we have to be Mother Goose, and you have to really grab your wings and take care of your own little ones, because if something were to happen, you can't say, well, he told me. No, it's really, you have to really just kind of, show your claws, if you will, and protect your babies at all costs.
Yeah. And this is a good comment. As a parent with school-age kids returning to in-person school with a newborn, it's unrealistic to have siblings wear a mask in their own home too. What we were saying is, if they're in direct contact with the newborn, holding it, playing it with the child, changing, feeding, the hands need to be washed, the mask should be on. And that's not hard to do unless they're under age 2. If they're over age 2, they should be able to wear a mask. You have a newborn.
Absolutely.
So we're not saying a 5-year-old has to run around all day long in a house with a mask. What we're saying is if they're in direct, close proximity, immediate contact with the child, the newborn, they should, right?
Yeah, it may be just for those 2 minutes that, the 5-year-old wants to hold the baby, and you're there. Obviously, never leave a baby alone with, a child. If they're holding the baby there, just for that time, they have to do their masking, washing, hands before and after. And that's just, that's just keeping your baby safe.
What about vaccinated grandparents who are visiting with unvaccinated people prior? If you have a vaccinated grandparent, I'm assuming they're older, they're going to visit a household that is unvaccinated, they're at risk. If
Yeah.
I was that person, and what the recommendations are, if they're visiting because they're considered a high-risk population based on their age or whatever, even if vaccinated, they still need to protect themselves by wearing a mask, physically distancing depending on where they are, indoors or outdoors, if they're going to be in contact with unvaccinated people. And now,
Yep.
if they're going to an unvaccinated household and then they're coming to yours, they're could potentially bringing that to you. So
Yeah.
that's important too, to know where, who they're seeing on a regular basis before they come into your home where your newborn or infant is, right?
Absolutely. The CDC
Yeah.
talked about sort of the guidelines of, multiple households visiting one household, but it doesn't need to be happening at the same time. If you have an adult that's visited 4 houses and then comes to your house, it's essentially like having those 4 houses in your house. So yes, you have to follow those guidelines. That individual would be at high risk since it's had several exposures, even if that individual is vaccinated. So masking inside the house in
So
those
we just answer this
cases.
question. So we're going to answer this one because we're probably going to get cut off, but I just want to attack this one here.
Yeah.
I've taken every precaution, but the statistics, child deaths, hospitalizations, etc., don't back the precautions and these recommendations. Where's the justification at this point? I'm going to tell you where the justification is. Until it's your child, okay, you have the right to say that. The CDC is making these recommendations for a reason. We don't need to have millions of child deaths to make these recommendations, or millions of sick kids. What we know is what we know, and we have to stop the spread of this disease. You can do what you want. We just don't pull these recommendations out of our behinds because we want to torture people. They're there for a reason. We've been in this pandemic for a year and a half, and I actually think saying something like this is not appropriate. It's so easy. And this was another post. It is a luxury to be able to quarantine and not have to go outside the home to work. It's a luxury to be able to have access to the vaccine when other people in this world do not have access to the vaccine. It's a luxury if you can properly socially distance because you don't live in a multi-household family because you live in India. So a lot of these things that we're able to do, the fact that this country has vaccines available is a luxury. It really is. So you can do what you want, but we're going through this and we're taking time of our day to do this for a reason. And kids do get sick. I don't care what the percentage is. And you do need to protect newborns and infants especially. Sorry.
Yeah.
I went on, but
no.
I mean, listen, it is what it is. And what is the justification? You don't have to justify yourself, but everybody else that's listening, they're going to take what we say and do what they need to do to protect their families. You do what you want.
Right, and we can talk all numbers all day. And when we talk about, for example, mortality or death in babies is only 0.3%, but when it's your child, it's 100%. And I see it. Again, we have seen it in the hospital. Very, very sick kids, and every single parent of those kids has said, "I should have."
Yes, I know, and then being able to stay at home and there's a lot of households in this country that have to have both parents work, okay? And they might be working as a server in a restaurant or being in a place where that increased exposure where other people are refusing to get vaccinated, but they have to provide for their families, okay? So being able to make that comment is a privilege and a luxury. I just want you to know that, Jenna J. Monahan, okay? That what you just said here is a privilege that you can even say that because a lot of people can't. So we did this conversation and this discussion for a reason. I'm sorry I got a little heated, but Dr. Fort is someone who takes care of sick kids and myself who takes care of sick moms. There's a reason why we're having this conversation, right?
Yeah, absolutely.
Yeah. So we have to take it very seriously. Okay. So thank you so much for taking this time out of your day. I think it's going to help a lot of people. I hope we answered a lot of questions. Unfortunately, there's still going to be some gray areas. There's still going to be some I don't knows. If you don't know and you need some guidance, start with your pediatrician, your child's physician. They can help maybe formulate a plan for you. Ask the school what they're doing to protect your child, what they're doing to decrease exposure, what they're requiring the other families to do, if they're cross-contaminating teachers in between classrooms, which is also important. It's not like we can go and ask, are you vaccinated? I mean, that's not fair to do either. We still, in schools, vaccinated or not, we still have to follow those guidelines. So that's the best that we can do. And
absolutely.
I hope this helps. Yeah.
I love that.
Any
Yeah.
parting words? Yeah.
No, I was just gonna say, I mean, obviously, yeah, like you said, we can't answer everything. If you
Yeah.
have more questions, please visit me at, the NICU Doc.
Yes.
You can follow me on Instagram. I also
Yes.
have YouTube videos on COVID and baby stuff. So please,
Yeah. What's your YouTube channel?
So it's the
Is
NICU
it
Doc.
NICU Doc?
It's
Okay.
the same, yeah, the NICU
Yeah.
Doc. So, please, again, I love comments, questions. I'm always on Instagram and on YouTube. So please feel free to ask all these questions,
Yeah.
and I'll get back to you
Yeah.
momentarily. But
All
yeah,
right.
I love it. Thank you so much for
Thank you.
letting me join you.
Okay.
Have a
Bye
great
bye.
day. We'll see ya.